According to the chairperson of the Public Accounts Committee, Asmani Basalirwa, the committee will interrogate the permanent secretary of Ministry of Finance to ascertain why his ministry sent funds over and above the hospital initial budget.
So actually, the Auditor General has advised that we ask Ministry of Finance to explain why they send more money for gratuity to Mubende. Why? Most likely, I think they wanted to use Mubende and maybe connive with these people to find a way of stealing the money.
But I'm wondering why Mubende had 100% release. This could be something that maybe has been happening even before.
I think we notified the technical team immediately, and they told us to let it be. And
when you say we notified, you also produce evidence. Yes, you lay on the table the notification.
Well, unfortunately, we did not notify them in writing, but I remember we brought it to their attention.
Section BA, subsection 12 of the Uganda Public Standing Orders 2010 requires payment of salary to public officers to be stopped immediately they cease rendering services to government. But according to the report, some staff at the hospital were still getting salaries after retirement.
One is that in Mubende Regional Referral Hospital, there are staff that had retired, but we are still on the payroll. And the explanation that was given by the accounting officer, in our view, was not satisfactory.
The Auditor General's report shows that many employees at the hospital faced salary deductions in unknown circumstances.
Deductions were being made for people who never had loan obligations. They don't have loan obligations, but there are deductions. So we sought to understand how the hospital could make deductions from staff that didn't have loan obligations.
The committee also found out that there is always demotivation of staff and accumulation of salary arrears due to delay of newly recruited and transferred employees to access payroll. According to the same report, in financial year 2020-2021, the hospital management also submitted performance reports past the deadline given for the submission of the reports.
Mubende, in all the 4 quarters, their budgets were submitted late. Now, either that speaks to incompetence or it's about a strategy to steal money.
Mubende Regional Referral Hospital was upgraded from a general hospital in 2012 and it serves districts of Mubende, Mityana, Kasanda, Chiboga, Nakasongola and Chankwanzi. Shamim Naiga, Gloria Gutabinji, UBC News.